Good evening. This is the Georgia Doty Community Outreach Program with the Doty Report on Comprehensive Health. My name is Beverly Walker, and I am your host tonight. I want to say hello to Mr. Doty, who is probably watching the show tonight. And I also want to say hello to our original host, Miss Yolanda Givens, who is out ill. We want to wish her a speedy recovery and hope that she can come back as soon as possible. Meanwhile, I am filling in for her. And we have with us tonight as our guest, Dr. Frank Vaught, Jr. And he is a chiropractor, inspirational speaker. He is a veteran of 8 years. He spent time in the Army, doing hospital medical nutrition, and he is the founder and owner of Health on Earth Wellness Center. He resides in Chicago with his wife and 2 daughters. His hobbies are traveling, mission trips, and running. He has also authored a book titled Achieve the 5P Process, and he has also ran a half marathon in 2015. Welcome, Dr. Vaught.
Thank you. That's a lot of information there, huh?
Well, you sent it to us. I didn't make it up, and I didn't write it. It was a lot, and I just took that little bit out of it because it seemed kind of interesting.
Oh, thank you.
But to start off, I see you have a spine there.
Yes. I keep mine with me, and I keep my motto as well.
Well, I don't know if mine look like that, but
we got some work to do there.
First thing I want to ask you is, you're the founder and owner of Health on Earth Wellness Center?
Yes.
What does that mean? What do you do there?
Well, Health on Earth Wellness Center, we're a wellness center. We do chiropractic care and physical rehabilitation. We also have acupuncture, massage, and but the biggest thing we do is we support people in having a body that functions, number one, without drugs or surgery. And so people come to us with like severe pain, aches, and we help them without taking a surgical route or without having to take the medication.
Okay, well that sounds like something I might need. And a lot of other people that I know.
Yeah.
I do want to say as we get started, we have our call-in number, 312-738-1060. It's kind of hard to read. Look kind of fuzzy. But hopefully our guests that are viewing the show tonight will call in and ask some questions. I know a lot of people nowadays are suffering with arthritic problems.
Oh, yes.
The knees hurt, the back hurt, the shoulders hurt. I have a cousin that just had shoulder surgery, got to have it again. I've had quite a bit of hip surgery myself. So I know what it's like to have these problems. So why don't you tell us what it is that you do when people come in and to see you?
Well, and that's a great question. It's every single person is different. When you come into and get a chiropractic examination at Health on Earth, one of the things we start off with is a detailed history of really looking at you, looking at lifestyle, looking at the things you do, the things you're involved in. And then we look at the particular health problem, crises that's going on or that you're involved in, and we put together an approach as far as to correct it. Now, we don't have a cookie cutter approach because we support your body in having exactly what it needs, whether it be lack of nutrition, whether it be looking at the nervous system, which is the biggest thing that really helps facilitate the body in healing. One of the cool things about chiropractic is anybody and everybody can benefit because your nervous system is what controls the entirety of your whole body, and it coordinates everything. So by us having this nervous system nice and clear, making sure that we that each one of these pathways of each one of these nerves is actually going to its organ, cell, or tissue, its muscle, without any obstruction, which is called a subluxation. The body heals tremendously, and it's an amazing thing. So as doctors of chiropractic, the biggest thing we do is support the body in its proper function, because we literally design to heal ourselves. So it's amazing some of the things that we get to
So
see.
can you got those little things sticking out there?
Sticking out over here.
Yeah, can you know, most people don't really see that close up.
Right, absolutely.
So can you tell us about what all that is?
Well, right here.
I see we have a caller already.
Oh, definitely. So we'll take that or answer this. We'll go with that.
Caller, do you have a comment or question?
Actually, I had a question. Nice to meet you, Dr. Vaught.
Oh, nice to meet you there. How you doing?
I'm doing great. Actually, my friend had referred me to you a number of times.
Okay.
She has some headaches as well as sciatica. She went to several doctors from childhood up until adulthood, undergone some surgeries, nothing could help. She started going to your office, and she got better and better. And that's all she goes on and on about. Oh, go down to Crestwood, visit Dr. Vaught, visit Dr. Vaught. What did you do to get rid of the headaches and sciatica? Because I thought a chiropractor takes care of back pain.
And you know, and that's a great question, young lady. Well, what I did with the, and I don't know which particular practice member we're talking about, but oftentimes, like we were talking about just a moment ago, when you have misalignments in the vertebrae, oftentimes with headaches, it's upper cervical, which is in your neck. And when you have misalignments there, they put compression on these nerves. Okay? What we began to do is we did an exam, we looked at lifestyle, and we took pictures of her spine. Now, when we took pictures of the spine and we looked at it, we saw misalignments. These misalignments are called subluxations. By removing the subluxations, we were able to actually restore the body's proper biomechanics, and then as well as nerve transmission. So the brain and body were able to communicate so much easier, and her body then was able to be restored, and they stopped. Oftentimes, too, things like the high blood pressure comes because of that, and it comes down. Now with the sciatica, that sciatic nerve actually exits out down here, these last two vertebrae down here, and she was just talking about those squiggly little worms. Well, these nerves that actually exit out, I want to see if you can get a good picture of these nerves on it. Well, they exit out right over here. Now, they come together and they go down the leg. And oftentimes that sciatica can be debilitating. I'm talking about my pregnant patients. I'm talking about my patients that do a lot of sitting, or people that are on their feet standing on hard surfaces a lot. They get that sciatica. When we removed that interference, what it did was it really helped. It really helped take that pressure off the nerve, and then her health was restored.
Okay, so I guess that answered her question. Seems as though we have another caller. Caller, you have a comment or a question?
Yes, I was asking Doc because after he explained about the sciatica, we do sit a lot at our desk. So I wanted to know, she told me you guys were in Crestwood, but you're moving.
Oh yes, we we definitely are moving. We have a facility now in Crestwood, Illinois, and we're moving to Alsop, and it's we're actually moving to a larger facility to actually be able to serve more people. We'll be adding in addition spinal decompression, acupuncture. Of course, it's going to be massage, and we're going to have a community health room, to where we'll be having constant workshops and lectures and things like that on health and wellness, and it's going to be for the community. Chiropractic is our primary focus, is our foundation, but we'll be able to meet a lot of different needs as far as with overall health and wellness, and we're really excited about our move that's going to be coming up, and yeah, definitely, thank you. Yeah, but we're there now though, so if you we're still in our location, so you definitely, if need be, can come on by.
So in addition to the spine and headaches, what all do you treat? What areas of the body do you treat?
Well, with chiropractic care,
Excuse me, we have another call, and he's just flashing this caller sign on the screen like it's urgent. Caller, you have a comment or question?
Yes, I do. Hi, Dr. Vaught. How are you?
Hello, how are you?
Oh, I'm doing so-so. I have a question in regards to arthritis.
Okay.
Especially with this weather, how it's been up and down, and I've been taking medication, and I want to know, how can chiropractic help arthritis?
Well, that's a great question, and I get this so much, young lady. When the weather changes or seasons change, anytime a season's changing, your body is adapting to its environment. So in the wintertime, the muscles begin to tighten to hold in more heat. All right, especially around joints. And it begins to get uncomfortable. And the areas that arthritis are in, arth means joint, itis means inflammation. So it's inflammation in a joint. So arthritis isn't a bad thing. It's a natural aging process of the body. It's the degenerative arthritis that's the problem. And where degenerative arthritis comes from is stress and malalignment in a joint for a period of time. When a body is misaligned or there's stress on any area of the body naturally puts calcium deposits in there to strengthen that area. But if that area continues to have that stress there from that misalignment or that stress, what happens is that bone becomes kind of jagged, and it becomes damaged. And what we do in our office is we restore the body's normal biomechanics, takes the stress off the joint, which allows inflammation to decrease, which allows proper circulation, and it decreases the pain and restores the body's ability to move and function. Because ultimately, what your body is trying to do when it's healing and repairing is to protect itself. It's trying to ball up. It's trying to build these bone up, but that bone is unhealthy, and that jagged bone literally it digs into your tissues. It becomes very uncomfortable, and it can be also very debilitating.
Okay, we have, I don't know if the doctor's not answering the questions fast enough, but we have another caller on the line. Caller, you have a question or a comment?
Yes, hello. My name is Michelle. So good to hear you, doctor. We got right into it, boy. So people got all these problems. I'm experiencing some of that change of weather pain. I know that I'd have forward head posture, and my neck has been killing me. I work from home, by the way, so I've been at computers for about 2 years for several hours a day. And so my neck is starting to kill me. Now, my question is for you. What are your thoughts on stem cell therapy and regenerative medicine? And can you, if the bones in the spine have degenerated to, I think, level 4, as you guys call it, can stem cell therapy regenerate bone that's been damaged, or is bone damage irreversible?
The body can always regenerate, except when it's like something lytic, or metastasis is begin to spread throughout it, or it begins to necrose. When you're talking about bone and degeneration is when you have the beaks and the claws aggressively around there. So what we do as chiropractors, as far as it regenerating, by motioning that joint and putting it back in its proper biomechanical state, okay, it reduces the stress. When the stress is reduced, you can have increased circulation. When you have increased circulation, all of a sudden you're getting oxygen and nutrients to an area that wasn't getting it, and then those supporting structures around it begin to help support more. Some of the damage that's there when you're talking about a phase 4 degeneration is going to be there, but your body can adapt to it and function properly, and it can get some of the healing benefit of restorative, especially in the area. And so yes, your body can, except on those instances that we just that I just mentioned. Now, when you're talking about the stem cell, you said the stem cell, the injections and stem cell therapy. I do have doctors that I send patients to get that. Some of them have got phenomenal results. More have than not. But one of the things that we found is that by us working together, by keeping the nervous system clear, and then also getting the therapy, the results have increased by over 30 to 40%. So it does have efficiency, I believe, but it's the way that it's things that you're doing. You got to be making sure you're hydrated. You got to be making sure you're following your doctor's recommendations. There's no thing that you're going to do that's going to just force healing in your body. It's decisions that you make, healthy lifestyle decisions that you make on a daily basis that are going to give you the efficacy as far as in healing the proper way. So yeah, working at all day at home, I mean, that's repetitive motion stress. One of the things you got to realize is that your body is a living machine, and like a car, you've got to get it tuned up. So if you keep driving your car into the ground and you don't get the oil change, even if it's a brand new Cadillac 2020, it's going to break down. So it's so absolutely.
We're trying to get all our calls in. Caller, you have a comment or question?
We're trying to get all our calls. Caller, you have a comment?
Yes, I do. Somebody else. Yes, I do. Okay.
Caller?
I have spinal stenosis. I'd like to know what can I do to help treat it?
I'm sorry. Could you repeat the question?
He said he has spinal stenosis. What can he do to help treat it?
You know, with spinal canal stenosis, so if anybody is familiar with that, what spinal canal stenosis is this canal back here. You have this canal back here where your spinal cord runs, right? And over a period of time, as we age with degeneration, that canal begins to close down because of lack of motion. All right, so it depends on, it's always dependent upon the area that it's in, and one of the things that we do, of course we go back to chiropractic. We adjust your spine. When we restore motion, it increases the area to take pressure off of the spine and the nervous system, so that stenosing back there on the spine begins to take the pressure off, which decreases things like sciatica. It increases function that those nerves go down to in the lower extremities, and it also stops the progression of the degeneration. Something else that's really big too is spinal stenosis oftentimes comes from inflammation. So there's things that you can do naturally to decrease that inflammation, along with getting adjusted. And there's things that are natural. That you don't always have to take an NSAID. An NSAID is good, non-steroidal anti-inflammatory drug, in an emergency situation. And I mean, I'm talking about absolute emergency. But things like cinnamon, garlic, cayenne pepper, red cayenne pepper, and turmeric with black pepper work phenomenal for decreasing inflammation and really making sure that you get that adjustment to motion that joint and build those stabilizers around it. And that's something I see on a regular basis and get phenomenal results with. So
okay, I'm hoping that we can get all our calls in tonight, but it's going to be really, really tight, I'll tell you. Caller, you have a comment or a question?
Hi, Dr. Boss.
Hello.
I heard you do family care, and I heard some of the things as far as chiropractic care within family.
Oh, absolutely, absolutely. A family that gets adjusted together stays healthy together, young lady. We see a lot of families, and it's one of the things I begin to do a lot more intensive studies in, family care, once I start having a family of my own. And I was just looking at a lot of the disparities and what's going on in hospitals with children and families.
I have kids in my family that suffer from knee and lower back pain. What are the age range for the kids that you do attend or help?
Well, I must say my youngest patient is 2 weeks old. And my oldest patient is 96. So we see a wide range of cases that come in with children and get some great results, especially with children. Children oftentimes are extremely, they heal so fast because their body's growing so fast, and they respond so quick to care. So our children's immune systems are a lot higher. We find that our kids do really a whole lot better in school because it helps with relaxation and decreasing hyperactivity. So it absolutely, and especially our children that are nowadays, everybody's playing sports, so it's something that's extremely common. We see a lot of kids, and would love to meet your family.
Okay, we have another caller on the line. Caller, you have a comment or question?
Yes, doctor. All this treatment sounds very good. I am calling from before. This is a follow-up question I didn't get to ask. Insurance. How does one pay for these services? If you don't have insurance that covers your services, how can you get treatment?
And that's great. We have
Call your office.
they call the office, but we do accept everything, and we don't send anybody away because of that. So definitely call the office, and they'll definitely get you taken care of. And there is a way. I think the majority of my practice members don't either, so don't have insurance. So that's perfectly fine.
Do we have another caller on the line at this point? No callers? Dr. Vaught, can you tell me where your office is located?
We're located in Crestwood, Illinois at 13657 South Cicero Avenue, Crestwood, Illinois. Right on Cicero and 137. The number is 708-396-2500. Again, the number is 708-396-2500, and we're located at 13657 South Cicero Avenue. Definitely, and if you have a concern, a health need, we'd love to definitely be the ones to take care of you, serve you, and I'm looking forward to meeting you.
Okay, so we have 5 minutes, about 4 minutes now to wrap up. You have been watching the Doty report on comprehensive health. We've had Dr. Frank Vaught Jr. here, who is a chiropractor. He is also does some nutrition work with the individual, and he has answered about 8 or 9 questions, I'm not sure. And we have another caller on the line. The number for the Doty program is 312-282-1375. You can also call the Georgia Doty program and get information, and he can also refer you to Dr. Vaught's office and give you his phone number because he's on the show tonight. I have about 1 minute. Caller, you have a comment or question that we can answer in 1 minute?
Yes. Do you have any staff that speak Spanish? Because my family speaks Spanish.
Oh, yes, definitely. In our office, we do have someone that speaks Spanish, so we do accommodate the community. So, it's awesome because all communities are oftentimes underserved, and so that's one of the reasons why we did add that aspect to our office, so we can make sure that we are able to serve the community as well. So, absolutely, young lady.
So, Dr. Vaught, I'm going to ask you, if you had one thing that you want to say about good health and nutrition, what is it that you would say to our viewers?
I would say that your health is your most prized possession. It's one of the greatest gifts you'll ever have, and one of the things that oftentimes that we neglect the most. We'll put everything in front of our health. We'll put everything in front of ourself, and we'll neglect the greatest gift that we'll be fighting for on our last moment. So your health is like a savings account. Deposit into it daily and watch the interest grow, and you will enjoy a very happy and full life. But it's never too late to start, so make the proper choices right now.
Okay. We are down to the last minute. Again, I want to thank you all for watching the Doty Report on Comprehensive Health. Again, my name is Beverly Walker. Glad to be your host for tonight. I want to give kudos to Mr. Doty, who is the Chief Executive Officer of Georgia Doty Community Outreach Program, and want to wish our regular host, Ms. Yolanda Gibbons, a speedy recovery so that she can come back and take her rightful position at this desk.
Yeah.
Thank you and good night.